Okay. It's functional? Yes.
Yes.
Okay. Hello, everybody. I am part of this session. I am Edgar Cabrera from Caracas, Venezuela. Right now, I am living and working in Madrid. I am oral maxillofacial surgeon. I am part of this first session with these two amazing, stunning speakers. This is part of my CV. This is all of we travel around the world to share our knowledge. But first of all, I want to thank you, Dr. Hall, all his team, specifically to the gaoforum directors, Diana, Sofia, Ayum. You are amazing and you did a great job to all of we to be here. I am very honored also with my friends, the core member, to share in different times of the day.
Okay.
This is my first time in 2019 in Seoul. After that, we had a wonderful moment in 2022 in Bangkok with an amazing symposium, obviously. Right now, we are in Turkey, and we have to discuss in the first session on rethinking the osseointegration process, now the classics versus the neo. I have on charge to the impact of implant design on surgical strategy significance. I want to start my goal list with 5 different questions, okay? How does implant design facilitate our daily practice? Or what do we know about our system, our implant design? What does the literature teach us, like which features of CMI implant design help me solving extreme cases? I am oral maxillofacial surgeon, like the doctor and other one. And all day, so every day in our consultations, we can perform this kind of surgery. This is a surgical extraction, just that, okay? And we can maybe give some different surgical approaches to our patients. And this is very important because these different surgical approaches with all your techniques and conditions, it's the main way to give the different loading periods, okay, for the anytime loading. This is the basis here. We have anytime loading. We have to review the characteristics, the bone status, the occlusal condition is very important, okay, and the design of the emergency profile system. I want to mention in this first part of my conference an article from Dr. Iñaki Gamboreña, and he mentioned the updated clinical technical protocols, okay, for a predictable immediate implant placement. And he talked about the provisional restoration is very important. The atraumatic extraction for the surgeons, okay, the preservation of the corticals is also very important. The ideal implant placement, if you perform the surgery with guided surgery or not, okay, and the primary stability, the number.
Yep.
The number, okay? It's also very important to review conditions like the 3D bone packing, the customized abutment delivery, or the use of the connective tissue graft. I have to review 5 different articles, okay? I want to start with the implant thread designs and overview when we compare the IS2 and the IS3. I want to mention Dr. Albrechtson, because Dr. Albrechtson is very important also like the PA branding mark in the literature, because Dr. Albrechtson give us the healing of the bone graft. He was his thesis direction, okay? And he mentioned the importance of 6 most important factors to establishing a reliable osseointegration, and they are the implant material, the implant designs, the surface quality, the bone status, the surgical technique, and the loading conditions. And for that scene, the dental implant function is simple. It's to transfer load to the surrounding biological tissues, the soft and the hard tissue. It's very important, okay? Don't forget the soft and the hard tissue. In all times, a few years ago, we have different implant body designs. The cylinder, the screw, the press fit. But right now, we are working with a different implant body designs. The cylinder and press fit, they are very popular in the 80s, okay? But they cause necrosis. And they have the loss of the crestal bone and the subsequent implant failure. For that scene, we changed this concept, okay? And right now, we are working with the threaded futures. They have the ability to convert the occlusal loads into more favorable compressive forces in the bone. For that scene, the tapered body design is particularly effective in regions with weaker bone, like the maxilla or the lower bone. And this is like you mentioned, Ricardo, okay? When we use the straight body, okay, and we apply our drilling protocol with the SCA system, we will find an spinning with the straight body implant. But with the tapered body, we have an ideal fixation undersized in a small hole. And this is for the CMI fixation. This is very important to remember. And this little device is beautiful for me because they imitate the natural condition of our patients. It's incredible, remember that. And it permits me, like surgeon, to make a little size in the hole, okay, to obtain the primary stability using the CSI, no sinus membrane damage, use the tapered implants, and also we will get the bicortical fixation. It's important. Also, we can manage and we can apply the anytime loading concept. Another advantage, in the anterior sector, for example, if we have fresh socket technique here, and we have to review the CMI fixation in these cases. And this, the key feature is the ability to achieve the strong fixation anywhere. For example, I reviewed different articles, okay? And the implant threads, like the square, the reverse, the square buttress, and the V-buttress are designed to facilitate the osseointegration. They maximize the initial contact, okay? They cause compression on the bone, and they dissipate the loads at the bone implant interface. But also it's very important, the magic threads specifically designed to withstand the occlusal and lateral forces. This is very important. Also, the implant threads, they deliver an optimal favorable stresses when we are under function, under loading conditions. The powerful apex is very important because they permit me to give the self-tapping, safe compactation, and easy insertion. In another article, they study and they evaluate the stress distribution with 3 different thread designs, the V-thread, the buttress, and the reverse buttress, okay? And they apply 100 newtons of vertical loads, okay? And this study evaluates the stress distribution with the cortical bone, the cancellous, and the implant body. The clinical success of the implantology, of the rehabilitation, is upon from the implant thread design. Look here, look the yellow line, okay? This is the surrounded bone on the force transfer through the implant to the bone. And it's very important to study geometry, the metallurgy of the implant, for example, and the difference variation in threads. When we analyzed this study, we found the bone miss stress, and we have different threads. We have the thread depth, and also we have the thread pitch. It's very important. For example, the thread pitch, they are used to help to resist forces in poor quality bone. But remember the importance of a drilling protocol. And the results of this study, the first of all, are the reverse buttress thread design exhibited the minimum bone miss stresses at the cortical bone and the least stresses at the cancellous bone. For that scene, maximum the forces at the implant indicating potential clinical implication for the appropriate selection of them. The second one, when we apply this kind of concepts, okay, the selection of the implant thread design plays an important role in the outcome of all our treatments, of all our rehabilitation, dear friends. And the third, and not least important, is the study funded to contribute a better understanding and the influence of various implant design on various implants thread designs to give to us, to all of we, a predictable implant therapy success. We are looking forward to success. We don't want to fail, okay? And the futures of the CMI implant fixation, for example, we have to mention a lot of them, but I will mention only 5, okay? The first of all is the best to achieve the ability or the stability in the soft bone when we apply the immediate placement, okay, in the lower jaw. And it permits me to give for the conical and sharp apex, which penetrate to the inside of the area very well, even after undersized drilling, because I have a lower density of bone when we compare with other characteristics, for example, the round apex or the straight apex. It's also important when we have to give all the conformation, the biological conformation of the fresh socket technique. It's very important because here we will find the primary stability in the palatine approach, okay, and the apical part. We will stabilize our implant in that condition, and here the biomechanical behavior in the implant threads play an important role, okay? And the bone implant interface. The second one, the powerful threads and bone volume and maximize the bone implant contact, like mentioned my friend Ricardo. Our deep lobe and half triangle thread permits me to resist to the pull-out forces, okay? And also the large bone are engaged between these threads, okay? And it is better than, for example, when we compare with the Brandenburg condition. In this study, for example, they evaluate the influence of different loading rates in thread designs. They analyze these thread designs, but for me, it's important, this conclusion, because this study found the adoption of the cover flanks for buttress and rubber buttress threaded implants resulted in a large improvement in compressive stresses and a considerable reduction in the maximum stresses. This is very important for my practice. And when we analyze the histological analysis, we have to look the BIC ratio, okay? It's important. This is the ratio 6 months after the immediate loading. And the implant body, okay, maximize the bone volume between threads with its self-tapping, and they permit me have the ability to resist the vertical and the lateral forces or pressures. The BIC ratio, this is a data for you, dear friends, is 88% with an excellent osseointegration. Even though if we perform a guided bone regeneration in all our cases, if we have to manage and to solve with the guided tissue use of the connective tissue graft, the implant bone interface can be compromised in this zone for high stresses. But we are looking forward, we are looking at the biological oriented results, okay? It's not the number, it's not the size, it's not just the stability. We have to review all the characteristics of our patients, okay? And the rubber buttress thread appears to be more advantageous than that. I go in fast in this part with the drilling protocol because you mentioned, Dr. Hall, right now, okay, with the crestal, the importance of the crestal widening and the importance of the pre-typing. I want to share a message with you. Greater the depth, greater the surface area of the implant. This is very important. Even though this is more advantageous in areas with dense bone lining, okay? This dense bone lining is in the distance between the implant and the bone contact or the bone implant contact surface. The number 3, they are strong again, the lateral forces. I give you time. The standard V shape versus the buttress design. Look here, look the condition. This is the forces, okay? And here we have an harmonical and harmonious distribution of all the forces with the vertical vector and the lateral vector. This is important because they provide me primary stability when I perform this kind of surgery in fresh socket. The biological conformation, look the alveolar condition and look the lateral wall. The bioseal is very important. We have 2 different features, okay? We have the IS2 and we have the IS3. The bioseal minimizes the bone loss, but if we don't have bone loss, like in this case, this is some dentoalveolar trauma. I don't have bone there. I only have the palatine approach and the apical, okay? I have to obtain the primary stability in this cortical, okay? And after that, I have to recover all the conditions. But my implant gives me the opportunity to give the primary stability to the immediate loading concept. And this is the follow-up. This is important also to review the periapical control series, okay? And it's the wonderful great changes after 3 years of treatment, okay? This is 3 years of follow-up, and look here, the result, okay? The bioseal for that scene enhances the soft tissue healing and minimizes the bone loss of the crestal. In the lower jaw, in the fresh socket, okay? It's very difficult to give for me, I don't know for you, but for me it's very, very practice to drilling through the root technique, sure. Okay? But my implant, okay, our system permits us this condition. And it is important because we have to reduce the shrinkage, the natural shrinkage of the alveolar process. It happens with all techniques. And this is the result we are looking forward. The last one, the surface treatment, the SLA. The SLA is not, it's very important, but all the combination on all the clinical conditions This surface permits me to give and stimulate the osteoblasts and boost the blood flow, leading a faster and osseointegration. As a result, we will have no stability dip. My conclusions. When an implant receives an optimal functional load, the surrounding bone experiences remodeling and produces woven bone. But remember, we mentioned before my lecture, under extreme adverse stresses, microfractures occur and the alveolar bone inducing the osteoclastogenesis. We can use this kind of system, we can give different solutions to our patients, okay? And this design maximizes for me the BIAC ratio. And also, this is very important with all the conditions and permits me to give the opportunity to the anytime loading or indeed extreme cases. Thank you very much. I'm happy to be here, Dr. Hall.
Thank you so much, Edgar. I'm very glad to see your presentation. I'm surprised you understand CMI implants, the total, the concept of CMI fixation and CMI implant design. Because, I'm the developer, I'm the designer of the CMI implant, because I'm a purpose of making this kind of implants. So I'm asking you, when you place that kind of CMI implant in your patients, how do you feel when you place in the soft bone? How do you feel that? You feel great, or how do you feel?
You have to respect the drilling protocol, and you have to not forget the primary stability and the torque. But it's very important when we analyze the case, when we review the condition of the patient, the bone quantity and the bone quality, okay, and the status of the bone. We are prepared before the surgery to that condition. And we have to respect the drilling protocol, and we have to remember with the use of the CMI fixation, the body implant, the type of the trap, okay, and which tools give me Neobiotech to solve this kind of conditions. Okay.
Yes.
It's very important.
So CMI implants are designed as taper body.
Taper body.
Actually, the taper body is good for soft bone.
Yes,
not designed for hard bone. So and also when you place implant in any bone, you can feel the very good insertion torque, right?
High insertion.
High insertion torque. But when you meet hard bone like a D1, D2,
yes,
and you get sometimes you get 100%, 100 Newton centimeters, right?
It's time to go back.
It never spin itself.
Yes.
It's just when you tighten, okay, it just goes down, right?
Yes.
But it's up to 100 Newton centimeters. And how do you manage that when you get it?
Good luck with that.
It's time to restart.
The problem of the CMI implant is not get the lack of initial stability.
Yes.
Always we get good fixation, like over 40 Newton centimeters. So how the design of that implant is for anytime loading.
Yes.
So when you place that implant, you always feel, oh, it's a good fixation. I like that. But how about the more than 40 Newton centimeters, like 100 Newton centimeters? How do you manage that?
You don't have to do it.
Stay away.
Is your lecture, no?
It's your lecture, right?
Yeah,
Yes.
It's our topic for all of us.
Yeah,
Yes.
And
topic, sir.
we are talking about placement drilling protocol, and it is very significant to understand what is the passive placement, what is the active placement, and to feel what kind of bone we are dealing with, because in the hard situation we always need make final drilling and pre-taping, even sometimes full taping, and to make the placement physiologically and respect the biology and physiology, and not make the overcompression and no bone heating. And we in this kind of protocol we can achieve maximum bone implant contact ratio without any overcompression. We will have no stability deep, even no stability deep. We can check it by our smart tools, and it is not now topic, but we can continue.
But Sorry,
Okay,
but
go ahead.
in my case, if you have 100 newtons, you don't respect the protocol. Okay?
No.
You have to do it.
Okay,
Yeah.
You have to restart
we
the
have to
condition.
Well,
Okay?
yeah.
You have
The
to
tactile
to-
feedback
yes.
gives us always
The bone
how to
condition
modify
use
our
the
protocol.
necrosis
yeah.
and all the things from
Therefore,
Dr. Alves.
therefore, we need to continue practicing. We need to continue documenting
Yeah.
and what kind of situation
Yes.
we are dealing with.
But most of dentists, when they meet CMI implant first time, they don't know the concept.
Yes.
So sometimes
It's
you know,
important.
it's important thing. And also, Dr. Edgar, you showed implant design. The thread design is designed for against the lateral force, right?
Yes.
It's very strong to the lateral force.
Yes.
When you get only apex fixation,
Yes.
still is a good fixation, right? Because of,
Self-tapping is
because of thread
important.
design, right? This is a very important thing, design. But one thing you have to consider that, you know, when you, if you don't think about the bone density, and then you get underside drilling or no pre-tapping, and then you get you know, over compression, then you may get failed.
Yes.
So that's the most important message and this
To share
to share,
with
right?
all.
Right.
It's important.
So maybe, you know, today and tomorrow we're going to talk about that. Every things. How do we get a good ideal fixation and get 100% success, even though we do the anytime loading?
Yeah.
Okay.
These details are very important
Right.
in our practice, and these
It's a great,
details
it's a
give
great
us
presentations.
Thank you, my friend.
Yeah, I'm surprising.
the high results and 100%
Right.
outcome.
And-
Zero failure.
Maybe, you know, it's a good design, but do you have any idea when you want to, if you want to improve some other design for anytime loading? Do you have any idea
Yes.
for the future
This is-
implant design?
This is a very nice question.
That's a dangerous
Because
question.
the full motto of this house is satisfaction to dentist. I am very happy with the system, with my surgical and also my prosthodontist team. But if we want to solve, like the doctor, atrophies, very condition with very poor condition, and we don't have enough amount of the bone, I need a longer implant.
Okay, for the maxilla?
For the maxilla, like
posterior
for
maxilla.
example, the
Zygomatic.
pterygoids and the zygomatics.
Okay,
It's gonna be wonderful to have with all the CMI conditions.
so how long implant you need?
We start on 40.
40?
Okay. Yes.
You mean-
For
you
the
mean
zygomatics.
Not 14, it's a 40.
40.
It's like that.
For example, no, my friend.
So all the you know, oral surgeon want to have that
Yes.
And the pterygoids as well.
pterygoid.
And the rhinos. Because
Yes, the
rhinos
transnasal.
as well, they provide a certain length that is not zygomatic because you're not trying to get the zygomatic bone. And
Right.
they don't have the same anatomical constraints as the pterygoids, but they provide up to 18, 20, 22, 24. So you can engage some of that premaxilla
Yeah.
with a piriform rim, and it's a great solution.
Yes.
And even if you can take it to the subperiosteals, but that's...
Isn't
that- that-
yes, that's good idea.
That's a different...
Another request.
That's another request. So you have 4 requests out.
You know, we think about how we can get the good fixation in the posterior maxilla, even though we have a limited the bone, available bone, but still I use less than 13 millimeter implant, but over time I get 40 newtons.
Yes.
So
For me, it's important, like maxillofacial surgeon, remember the importance of the anatomical buttress. Okay. For example, when we perform the sinus lift, we have the sinus floor, and it is cortical bone.
Right.
Here we have beautiful bone.
Right.
In the pterygoid, for example, the doctor mentioned, we have a lot quantity of cortical bone.
Yes.
And in transnasal, it's also very important.
Okay.
It gives me the primary stability to solve these kind of cases, giving the opportunity to the patient to obtain the immediate loading concept with aesthetic plus function.
Yes.
We are looking forward and,
Okay.
and the success.
Okay, I will consider that. Thank you.
It would be really nice to see how those threads perform in the rhino position or the rhino location, because most of the rhino implants in the market uses the conventional threads and not the thread design that the CMI concept
Yes.
has come up with. It would be very interesting to see.
It's
Very
very
good.
aggressive.
Yeah,
It's very
interesting.
aggressive.
Yeah.
But there's some risk to get higher stability. I mean, so we have to think about that. You know, we have to modify and consider, and we have to know the drilling protocol.
Yes.
It's very important. We're going to talk about that today. Okay.
Thanks,
Great.
Doctor.
Good job.
Thank you.
Good
Thank
job.
you. Ladies
you.
and gentlemen, please join me in thanking Dr. Edgar Cabrera for today.
Thank you.
Thank you.